Welcome back to my channel today with a different format. Since I'm going to open up the next cohort of the Biomechanics mentorship in the next couple of weeks, I wanted to provide you with some insights of what we're doing in the mentorship. And today we're going to talk about the weighted dip, the biomechanics, the different phases, and how to troubleshoot. The weighted dip is not just a triceps exercise. It's a closed kinetic chain movement. What does that mean? The hands are fixed and the body moves in space. And that is an important thing because when we're talking about closed kinetic chain movements, the scapular humeral coordination, so the coordination between the shoulder blade and the upper arm, becomes very important. Because if we look at the shoulder blade, right, it's only attached through the clavicle to the sternum, or our manubrium, that's the top part of the sternum, and there is literally no other structural connection except some muscles that pull the shoulder blade onto the ribcage, right? And only this small thingy here is what holds the shoulder blade in place. And the connection between the scapula and the ribcage is of utmost importance, especially in these closed kinetic chain movements. And during this lecture or during this video, we're going to talk about on how we can restore the relationship between the ribcage and the upper arm, so-called scapulohumeral movement, to optimize the shoulder flexion and extension arc. Shoulder flexion is us raising the arm overhead, shoulder extension pulling the arm back down again, and hyperextension driving the elbow behind the body, right? And the dip, as I said, it's not just a triceps exercise. It's an exercise that has a very high demand on end range of shoulder extension. Okay, there is literally very few exercises where we can get the elbow as far behind our body as in a dip, and therefore it is very important that the connection between the ribcage, the scapula, and the humerus are sequenced in a way that optimizes our performance and helps us get rid of pain, especially if we are in the situation that we're dealing with discomfort or pain. Now, one of the key requirements for a good scapular humeral coordination on the ribcage is the so-called stack. The stack is this cylindric posture here on the left side, and on the right side we can see the scissor, or this open scissor, right? The stack entails a neutral position of the head, ribcage, and pelvis. And if we are able to get into this position, we will create a position where it's easy and to get the diaphragms into a parallel position. If the diaphragms are stacked with each other, then we can expand the ribcage and the pelvis, and this is very important. Okay, if we look at the scapula, then this is this kind of dent thingy, right? And the ribcage is this round thingy. Call this convex and concave. And if the ribcage is compressed, like it's flat on the back because we're pushing the ribs forward, for example, like here on the right hand side, then the scapula cannot sit nicely on the ribcage anymore. And with air, like breathing, we can expand the ribcage. Okay, what does this mean? If we are lacking scapular movement or pain at the shoulder, then sometimes the movement of the scapula on the ribcage is restricted. As we've just talked about before, there is no structural connection except the clavicle to the sternum, and that small attachment is also joined where is already some movement happening, right? So we need to ensure that there is congruence between those two structures to optimize the movement of the upper arm. And if we are not able to assume the stack position and we are moving into some sort of compensatory pattern, like an overly extended spine, like we can see here with the ribs being protruded forward and also the pelvis in this anteriorly rotated position. Another extreme would be the exact opposite, us completely rounding the shoulders, tucking the hips more under, and protruding the body into the opposite direction. Both are a compensation for the stack, right? The stack is the neutral position, and if you're not able to assume that neutral position, then you will have a hard time transition from shoulder extension into flexion with a coordinated manner that hopefully is symptom and pain free, right? Now, obviously we need to keep in mind when it comes to pain in training that we are only working with non-traumatic movements. Non-traumatic movements is, for example, shoulder pain that has originated over a training block due to increased volume or increased intensity. And when we're dealing with some neurological issues like numbness, tingling, then this is definitely a red flag, and this isn't something we should treat, right? Then we should recommend that person to someone who has some actual scope about that. And we are only treating pain that is on a scale of 0 to 4. Ideally, 3 hours after the training and 24 hours after the training, the pain didn't get worse. If the pain exceeds that 3 to 4 scale, then I'd highly recommend to back up for the next training session, because you might have gone a little bit too hard, or you need to change your exercises or the execution, simply because you are exceeding a pain threshold that usually results in doing more damage than good, right? And if you're exceeding that 4 out of 5 scale, what I usually recommend is to take 2 to 3 days off, especially if the pain got worse 3 hours after the training or 24 hours after the training, simply because you will push through structural friction, and that usually, as I said, does more harm. Now, when it comes to the dip itself, we first assess the person in front of us, right? We can obviously troubleshoot the dip itself. We can see certain movements happening or not happening, and to ensure that we are making the right decisions, we're using a couple of different tests. And these tests tell us if we are mobile enough to execute the whole dip pattern or the dip arc. And the first test that we're going to use is a shoulder flexion test. We're going to lay supine on the ground, ideally with the lower back flat in contact. What I usually tend to recommend is a hook lying position, so feet flat on the ground, and then we are reaching the arm overhead, ideally straightened and supinated throughout. And as soon as you feel a limitation, as soon as you start to compensate, rotate towards the working side, roll onto your neck, flare your ribs, then the test is over. And the shoulder flexion test tells us if we have genuine expansion and compression abilities at the ribcage. So can we inflate and deflate the ribcage with air? So can it get bigger and can it get smaller? Movements that are needed when we drive the arm through space, like we're doing during a dip. Then the next test that we're going to use is obviously the shoulder internal rotation test, because the dip is an internal rotation bias movement. every movement where we're going to drive the elbow behind the body, like in presses in the horizontal plane or behind our body, that's usually internal rotation bias. And strategies that reduce internal rotation too early during a dip might lead to pain at the bottom of the movement or during pain during the descent. So people that tend to lower very slowly on the first rep of the dip, they usually or too internally rotated in their shoulder in the first place, so they might need to do some shoulder external rotation work to create more space, to have a smooth negative. And with this one here, we're testing our ability to keep the front side of the rib cage open. Then the next test is the opposite movement, that is shoulder external rotation. And with this one here, what we're going to do is we're testing our ability to externally rotate our shoulder, right? We can do this with the elbow in a 90 position with the hand facing the ceiling, and then we're just letting the hand drop down to the ground. And what this will do is it will help to tell us if we have space at the back side of the rib cage, right? Internal rotation front side, external rotation back side of the rib cage. And that is an important thing, simply because if we were too externally rotated, or the body moves into a position where he pushes the ribs out and pulls the shoulders back and down, he tries to orientate the scapula in a way where it looks like we have access to external rotation. But for this person, it might be very, very helpful to actually create more posterior expansion, that kyphosis, that rounded back posture, to really help unlock more external rotation again. And this is also the opposing movement. When reversing the movement out of the dip position, we need to get from an internally into an externally rotated position of the humerus. And this is anyway an important thing that you gotta keep in mind. We're always transitioning between internal and external rotation. That is an ongoing cycle and something we gotta keep in mind when it comes to troubleshooting in general, simply because if we're lacking movement, then we're either lacking external or internal rotation. And that might sound a little bit too simple, but it is like that, especially with the system that I'm working. Movements are simplified. Internal rotation is the same as adduction, flexion and stuff, So if you know what these movements or how these movements are categorized, you can make screening movements so much easier, and also troubleshooting. And that stuff that we talk about in the Biomechanics mentorship, I will provide you with my coaching framework step by step. We will start at the very bottom, and I'll provide you with some knowledge you've never seen, and that will change a lot of things and how you think about training. And obviously the last test that we're going to use is the T-spine rotation test. All of these tests have told us, and the goal of all of these tests was to see our ability to expand the ribcage. And with this one here, we are also looking at the rotational component of the spine, because this is a phenomenal test to see if we can expand each side of the ribcage, right? It's a 300 dimensional expansion that we need when we breathe in, and not only front side, back side, or side, right? And with this one here, we are really testing our ability to expand the sides of the ribcage, our ability to rotate, and obviously create enough space for the scapula to glide on the ribcage. Then let's talk about the 5 phases of the dip. The dip starts in the support hold, right? That's the top position of the dip. We initiate the movement. As we initiate the movement from that initially stacked position with a slight protrusion to the front of the scapulas, we want to avoid extreme crunching or extreme flaring in this starting position. We then start to lower the hips and let the elbow track behind the body. And this then moves us into the second phase, where we then move from the static position into the eccentric position, and from humerus that is initially more externally rotated into a more internally rotated position. At the bottom of the movement, the bottom reversal point, we hit max shoulder extension, so the end range of our shoulder. And the goal there will be to reach depth by slightly lowering the shoulder blades to shrug up into the neck. Yes, a little bit of retraction is actually needed here. And what we will see is that at the very bottom of the movement, slight horizontal displacement of the pelvis. Because initially, when we look at the dip, most of the movement is vertical, but then at the very bottom the movement becomes a little bit more horizontal. We start to push the hips a little bit more backwards in space. This is because of us trying to hit that end range position that is required to hit competition depth. And then we're going to reverse the movement, and we're going from this maximally internally rotated position back to a more externally rotated position as we push back up. And the sternum being more depressed in the bottom position and becomes more upright as we start to push back into the starting position. And then as we finish the dip, we drive the elbows a little bit more towards the body again, so finishing with horizontal adduction, and we will see that the shoulder blades depress and protract ever so slightly in the top position. And we're starting in an externally rotated position, moving into an internally rotated position, back to an externally rotated position. And this is the rotation cycle that I've been talking about. It is this ongoing cycle that repeats in literally all the lifts. Then let's just go over each phase quickly. Now, as I said, the first phase usually starts in that support hold. Chest is being pushed out, sternum upright, scapula neutral, upper arm slightly externally rotated. And we don't want to engage our prime movers here, right? Like our pecs and lats. Why is that the case? Because that will limit the movement of the upper arm. So what you can do for yourself is try to protract your scaps and now try to drive your elbows behind the body. Well, it's not working, right? And if we have a hard time assuming this neutral position, we can really use our abs, in particular our side abs and our breathing, to assume a better initial starting position, because a better initial starting position is key for success in the following phases. And the next phase that we're going to talk about is the eccentric descent, right? We're going to drive the elbow behind the body. The sternum still remains more upright. The humerus transitions from an external rotated position into internal rotation. And as I said, we will see mostly vertical displacement during this phase in terms of the pelvis, and then as we move into the bottom position, we will see a little bit more horizontal displacement. And as we've talked about in the very last portion of the exercise or the dip itself, we can allow, or we should allow, for some slight retraction to happen, which we call the so-called reverse shrug, right? And that really helps to get more range of motion, actually let your body work as it's supposed to with the right sequencing. And yeah, there is this debate of, should I crunch my dips heavily or should I stay more upright in the dip? And well, there is no right or wrong answer. I wouldn't move into any extreme, so I wouldn't overly extend or overly crunch my body, simply because as soon as you start to move into extremes, you will lose movement elsewhere, okay? If we talk about longevity, a more upright, neutral dip is probably better in comparison to the crunch dip, because the crunch dip only lives within competition standards and is meant to maximize the competition rules, right? So the competition rules dictate that the belt and needs to be below the bars, the rear delt needs to be below the elbow cap, and due to this reason, athletes obviously try to manipulate their lifts to work within those ranges to obviously optimize performance outcome, as they did with powerlifting, wide grip bench, and sumo deadlifts, for example, right? Also in street lifting, we can see certain techniques adapt over time. But I'm actually I'm an advocate of a more upright dip, not just because of hypertrophic reasons, because it maximizes pec length, but in general because it respects of how the body actually works. And then obviously the phase 4 and 5, when we push back out of the bottom position, the pecs start to drive more, they help more with this horizontal adduction component. And yeah, many lifters, especially lifters that use a very narrow grip, they tend to have issues getting from their pecs to their triceps. And in such cases, it can really help to widen the dip setup ever so slightly. And as we've talked about before, during this phase, we're moving back from a more internally rotated position into a more external rotated position, and as we are more crunched at the bottom position, we become more upright as we push back up into the starting position. Then let's talk about troubleshooting. Now, a very common thing is that people tend to have pain on the negative of the dip. So in particular, as soon as they initiate the movement, the shoulder just feels off. And that is usually an issue or a strategy that reduces internal rotation too early, as we've just talked about before. That's usually those guys that tend to have some sort of rounded shoulders. And if we're presenting with rounded shoulders, I'm now exaggerating it, the shoulders are kind of in this slightly elevated position and already internally rotated. So for these people, starting in a more externally rotated position can be very, very useful, okay? What does that mean? You don't want to tuck your elbows too much here, okay? If you do this, you will just limit the upper arms movement to actually move into internal rotation, okay? So what you should do is try to initially rotate the elbow pits forward and then drive the elbows back in space rather than tucking them in. And obviously a nice exercise to improve the ability to drive the elbows a little bit more back in space and not tucking them. And the pin dip is a great variation to do that because it helps you to lower vertically and you won't lean too much forward. And as you won't lean too much forward, the likelihood of tucking the elbows is also reduced. And also too wide grip can be detrimental for these persons, simply because with a wider grip, the ability to actually the need of internal rotation has increased, okay? Because the wider you grip, the more internal rotation the starting position requires. And if you're already so internally rotated in the first place, obviously you're running out of space as soon as you start the movement. And yeah, so just keep that in mind. Try to use some sort of medium grip here, because the very narrow grip, as I said, tends to lead to over tucking, which kind of reinforces external rotation, but then limits the ability of the upper arm to move behind the body. And we really want to learn the body how to actually move into an internally rotated position, keeping the chest open. Now, as we've already started talking about grip width and hand placement, we should touch on it shortly again. Now, as I said, the wider grip has a higher internal rotation demand and is best for mobile shoulders, but it also comes with less range of motion. This less range of motion is also coming with a higher demand of shoulder stability, okay? Just because your shoulders are mobile, it doesn't mean they're stable, okay? So you need to ensure that you can actually sustain that width. And before going ultra wide, I'd recommend to widen the grip step by step. Then, the more narrow your grip, the more range of motion you obviously have, and the lower the internal rotation demand. But as I said, the likelihood of tucking the elbows will be increased here. And if that's the case, then we are limiting shoulder movement most of the time, okay? Remember the example that we just had before. Don't protract your scaps or try to protract your scaps and then drive the elbows behind the body. Doesn't work as nicely, right? And we can adjust the thumb position or the hand position to help us guide in the right direction. So if someone is already so much internally rotated and wants to do a wide grip dip, it could make sense to actually drive the hands more out to the side and create more of this externally rotated position. And I've mentioned the thumb overhang here. So basically by putting the thumb on top of the bar, you rotate the hand more out to the side and you drive more external rotation, right? And on the opposite side, if we want to drive a little bit more internal rotation because we're too externally rotated because we're presenting with a rib flare, then the opposite hand position would likely be the right one. And we can also adjust the lower body position to adjust we can also optimize the lower body position. We can also optimize the lower body position by adjusting the weight. We can also optimize the lower body position by either adjusting our legs and feet or the belt position and the weight placement. So usually we tend to have either people who do 10% with a sway back posture or an anterior pelvic tilt. Sway back posture are those people with that squished glutes, tucked under pelvis and rounded shoulders, whereas the anterior pelvic tilt guys are usually the ones where we see the rib flare, the anterior tilt, so the lower back arch. And for our anterior pelvic tilt guys, it could make sense to bend the knees, have the weight slightly higher, and squeeze the plates to promote a little bit less anterior tilt and more posterior tilt. On the other hand, for the sway back posture, as the pelvis is already in this posteriorly rotated position, we might need to create more anterior rotation of the pelvis. Okay, so we will probably aim for straight legs, pointy toes, to kind of drive more anterior rotation of the pelvis. Sorry for the picture here. Been using something new, and but yeah, you'll get the concept, right? If I push my toes away I'd be doing when I run, like I would do when I run, then obviously I'm going to extend the hip and drive more anterior rotation, more extension through the spine, rather than tucking the pelvis under, which is the key when we want to apply the load between the knees or have the belt slightly lower on the glutes rather than on the lower back. Because if we put the belt on the lower back, it pulls us into this extended position. If we have it slightly lower, we can keep the pelvis a little bit more neutral. And obviously there are some archetypes and things that we need to respect when it comes to matching the technique to our structure or our anatomy, right? On the very left hand side, we can see the rounded shoulder lifter. That's our stiff boys, stiff girls, usually a sway back posture, very tucked down sternum, rounded shoulders. They have limited ability to drive the elbow behind the body, and for them it's of utmost importance to learn how to open up the chest, and usually a more narrow grip can be very helpful for them, and I'd avoid crunching in this case here. Then if we've got a very mobile long-armed lifter that has a very high range of motion and an instability risk because he's so mobile, then a wider grip might be helpful, but keep in mind, don't go too wide, because the wider you go, the harder it will get to keep those shoulders stable. And obviously we want to focus on a nice stack. Active depression is not completely true. As we've mentioned before, we want to let the shoulders retract ever so slightly as we move into the bottom of the dip. And then obviously the last one is the competition dip. The competition dipper optimizes the technique or the competition rules to their needs, with a strategic crunch at the bottom to actually meet competition depth, hip belt below the bars and rear delt below the shoulder. And in terms of efficiency for moving the max amount of weight, this is obviously the best one that we can choose. When it comes to efficiency for hypertrophy, a more upright position might probably be better, also for longevity and to respect how the human body actually works. Now, that's a wrap for today's video. I hope you like it. I hope you got an insight in how I work, what we talk about in the mentorship. Obviously, this is not what the exact content that I teach there. And if you're interested in learning more about street lifting, biomechanics of how the body actually works, then reach out for the next cohort of the biomechanics mentorship. And if you haven't done yet, please help me grow this channel by liking this video, subscribing to the channel, and turning on the post notifications so you don't miss out on any new videos. And yeah, if you want to work with me, get some more insights, the links are down below in the description, and see you in the next one.